everyone. Thank you for spending your lunch hour here. I know lunch hour is special, it's sacrosanct, and only in conferences do we let go of our lunch and we come here and sit here. So thank you. And maybe all those who are milling around and thinking they need to go out for lunch, you could bring your lunch here and join us. Because this is one of the most special panels you will attend. And I say this because I grew up in India. I grew up with the fallout of unsustainable development. I grew up not quite understanding from the biology textbooks what women's health was all about. It's a little bit of a chapter, it's a little bit of a subtext, and I discovered to my horror that we're all in the same boat. There is no biology textbook today which actually talks about endometriosis and talks about what really happens when you get your period. And these are all these taboo topics. There's 500 million women out there who have no idea what is happening to their bodies. And we are united by that. And we need to do something. I'm Devika, Gopal, Agge. I work with the New York Women's Foundation, where we really believe that centering women is super important. We cannot have any discussions on climate, equity, justice, health, without recognizing that unless we have healthy people, we will never have a healthy climate. And so I am going to invite, we were going to have a fireside speaker, Säbeen Fatima Haque. She's unfortunately unable to join us because of a family emergency. So my apologies on her behalf. Säbeen really wanted to be here, and you would have been fascinated to hear her story of how she founded doctHERs. However, that also means we have a phenomenal opportunity because I'm going to bring our panelists out first. Each of these women are rock stars, and you are going to have the most fun conversation listening to them. So without further ado, I'm going to invite my panelists on stage. Can we have Isabelle? And can we have Maïa Alexander? And Ashu Martha, please join me on stage. Awesome, awesome. They're coming, they're coming. This wasn't a solo initiative. Isabelle Verguin, Ashu Martha, Maïa Alexander. A lot of people try to introduce the speakers. I won't make that mistake because I am going to ask these women to introduce themselves one by one and share with you the phenomenal journey that they have undertaken personally and professionally to create what you've created. So Maïa, will you go first?
Okay, thank you, Devika.
Thank you.
So I'm Maïa Alexaline. I'm a scientist by training, and it's been 15 years that I've worked in women's health innovation. So I can tell about my journey now. Do you want to go?
Yes,
yeah?
please, absolutely.
Okay.
Share with them. What brought you to this point?
Well,
why did you find this Live Healthcare? What does it even do? And why is it relevant to all these lovely people?
Well, I started working on women's health because I wanted to tackle all these healthcare unmet needs on women's health that were usually neglected by the more traditional industry. For example, I know that all of you will understand what I'm talking about when I'm saying side effects with hormonal contraception, pain during IUD insertion. Well, this was typically unmet needs that were neglected. So that's why I started to work on that. And then I was really concerned about all these inequalities in terms of healthcare access and in terms of research on the specificities of women's physiology in terms of medical healthcare. So 3 years ago, with my two partners, we founded Live, and it's a company, and our mission is to radically change the life of millions of women suffering from endometriosis. So why endometriosis? Well, usually we know, oh, okay, yeah, endometriosis, it's pain during menstruations. Well, it's not only that. It's a disease that concerns one woman out of 10. So it's 200 million of women in the world. In terms of global cost, it's 10 billion per year just in France. 10 billion. And 70% of the patients are suffering from debilitating chronic pain. And what do we have to face such a major health challenge? Well, we have zero curative treatment, none. We have healthcare professionals that are just starting to be trained on the subject, whereas the disease has been described for more than 150 years. And we have a research that is 15 times less funded than other diseases. So that's why we decided to help women and to provide them means and tools and to handle their symptoms. So we developed a digital therapy to help women manage their endometriosis symptoms based on integrative medicine and non-pharmacological treatments. So it's education, nutrition, physical activity, mental health, and sexology.
That is fascinating. Thank you. And we're going to dive back in and circle back on what that means. But I'm going to invite Ashu Marsa to please share more about her organization, Mom and Baby, and your journey.
Hi, everyone. It's really amazing to be here. So my name is Ashu Agbornyenty, and I'm a midwife and reproductive health specialist. So I love to laud the fact that I'm a midwife, and I equally love to identify majorly on the point that I'm not just a midwife who delivers babies, but one who has engaged or embarked on a journey to deliver change as well. So my journey to creating For Mom and Baby Foundation didn't just begin in a day. Being a young midwife, I witnessed the tragedy that so many women encounter, not just during pregnancy, but even before pregnancy, during pregnancy, and after they must have had that baby. And given the numbers, the statistics, given the fact that my country has a maternal mortality rate of 438 per 100,000 live births, that's Cameroon I'm talking about. And we are currently facing a socio-political crisis, and I work mainly in the regions which are majorly affected by this crisis. So it makes it really challenging to get to these women because they don't have access to quality healthcare you would normally expect a woman to have. So when I work with these women, when we engage with them in the community, we get to listen. Actually, listening is one thing I learned during my work as one person who, really loves working with women, because I got to discover that I went to this community, yes, I was doing the work, but I didn't quite listen to the women. I kept doing or getting to do innovations or things that I thought was necessary, but I wasn't listening to them. So it was a game changer the moment I began listening to them. It will amaze you to know that these women have so much to share, so much to talk about, and so much pain inside of them, and they just need someone to listen to them. So the For Mom and Baby Foundation is a not-for-profit organization that specializes in advocating for maternal and child health care in Cameroon. And we are very, very passionate about working with these women. And so far, we've reached out to over 2,400 women in those crisis-stricken areas. And we've distributed about 340 emergency kits to pregnant women in these crisis-stricken areas. And so far, so good. We keep getting there. And I believe the journey keeps getting interesting.
Thank you. Isabelle?
Hi, everyone. Super happy to share the stage with those three wonderful women. I'm Isabelle. I'm the co-founder of Jeen. We try to elevate the standards of women's health with Jeen, which are health centers dedicated to women. And I wanted to start to talk with one story. If I say someone is having a heart attack, I think most of you, 90% of you, you'll think about a white male, 60 years old, having a heart attack. But actually, the heart disease is the first cause of death of women in the whole world, and we don't know that. And actually, when a woman has a heart attack, people will start diagnosing an anxiety attack, because actually herself, the practitioners, their closest ones, they don't know that the symptoms of a heart attack are different between a man and a woman. But we have studied heart attack on the male body, so the symptoms of the woman are not super well known. It means that you have 1 hour delay in taking care of the heart attacks for women. And when you have medicine, the medicine, like most of the medicine has been tested on animals and the male's body, which means that women have twice more secondary effects than men. So this is just heart attack, but actually it's a whole medicine that has been studied on the male body. So we have to review the whole thing here. I mean, there is so much work to be done. And if we just focus here on women's health, we lack of gynecologists. We have so much medical wanderings with endometriosis, for instance, but with so many others. We have this human dehumanization that you were talking about, the lack of listening. So we really need to tackle those topics. And this is what I discovered 3 years ago. I'm not from the medical world. I used to do business and project management. And I met a midwife 3 years ago, Valentine, who's my co-founder. And we really wanted to take this topic and create something big. And this is what we try to do with Jeen, with the first health centers that opened in May in Paris, in the 11th arrondissement. So you can go if you want in the next few days. It's a great place, and I'll say more things, I guess, later on this.
Thank you so much. That is fascinating. Have any of you ever visited a women-only health center? Yes, thank you. And did you have a great experience? Absolutely. I think the conversations we're having here are not necessarily about saying it's men or women. What I hear these three amazing individuals share is about listening, is about collectiveness. And what is happening is that though science seems to have made a lot of advances, it hasn't really. Because there are topics which have been not quite talked about: endometriosis, immunization, heart attack for women, from a women and a gendered lens. So maybe I'll ping it back to you, Isabelle, and tell us more about the journey for setting up something like Jeen, a women's health center, funding it, finding people to believe in this mission.
Yeah, I think building a company is hard. Building a company in the health system is quite hard. Building a company in the health system on the woman is like super hard. But I think what's interesting is that today, since the Me Too movement, I think in 2018, voices have been heard. And I think that we started to talk a lot, and I think our voices now reach people and reach the investment world. So the first thing when you create a health center is that it costs lots of money. So we had to raise some funds. And well, the French state is not doing well right now, so it's hard to get public funds. So we decided to create a company with a social mission, but to use the investment of a company to create it. So we did a first fundraise with business angels 3 years ago, and we're actually closing the second fundraising with business angels as well. And I think that people would say it's hard to find investments when you're a human because women entrepreneurs, they raise 4 times less money as men. But I think actually I totally forgot that aspect. And I said, okay, I have a great project and a huge market. I mean, it's 51% of the population. So I have a huge market, I have a great project with lots of impact. I have a business model, and I think it's quite important to say. And I think it can really change the world. There is this McKinsey study that was live, I think, three weeks ago, and that says that actually, if we invest in women's health in global, like the whole world, we can boost the economy by $1 trillion a year by 2040. So I think investing in women's health can really change the whole world, and I think that investments start to hear this. And so we had quite a good echo in the investment world, also from men, actually, which is great. And I think my dream capital is to have men on board because they're totally part of the journey. And I'm happy to see that I have great men really invested in this.
Brilliant, thank you. Ashu, would you like to go next, Ashu Martha?
Yes, thank you very much. And I mean, my journey starting the Form 1 Baby Foundation it's really emotional looking back because, like I said, I'm a midwife, and I'd love to say the Form 1 Baby Foundation is the first ever midwife-led organization. And that's just to tell you that midwife or midwifery is a profession that has been generally underlooked. I don't know about it in your various countries, but in my country, I remember telling my siblings, it's midwifery I want to study. And everyone in the family looked at me like I was speaking jargons. They were like, what are you going to look for in midwifery? There are so many other occupations or professions where you can make a lot of money in no time from now, but you chose midwifery? Are you serious? You know, and everyone was on my head. Everyone was discouraging me. But then, you know, I knew what I was going in for, because prior to that time, I engaged in 2 different departments in the university. The first year I studied environmental sciences. It didn't work out for me. The second year I moved to another department, microbiology. It didn't work out for me. And then I found myself in midwifery. And I mean, I remember during the first days of class, I felt really connected to the lecturer, or, you know, to what was going on in class compared to the previous years. And I decided to engage with other local organizations to just, you know, see more about what's there to know about the profession. So I engaged, you know, went to the community, started seeing women. You see a mother carrying a baby on her back and really doing this tedious work. And I'm like, how do you do that? And then I begin this conversation with them, and it just flows. It was really easy. Until now, it's really easy for me to talk with the women. So I remember during one of my first internships as a student midwife, it was really bad because I met this woman who was almost like full term, I think 8 months and 2 weeks pregnant, and it was her 7th baby. And she had little or no idea about what pregnancy was all about. Believe me, it does exist in my country. She had no idea, and I had to take her through the journey. Oh, this is why you're experiencing this. Explain a couple of concepts to her, and then she understood. In that instance, I had the idea, you know, to start writing books, little books this small, because people are scared to read books generally around my area. They're scared to read. Once they see a book this big, they're like, oh, this is not for me. So I decided to put it down in really small sizes so that it will be easy for the women to just, you know, flip past it and assimilate. And that was good. The very first one I wrote, Making the Most of Your 9 Months, was really good. I mean, the women got it a lot. And after that, I felt like that still wasn't enough. That wasn't enough. I didn't feel that was all I could do. So I went ahead to create a Facebook blog called Marty's Midwifery Diary, which is still existing, you know, majorly to educate women about their health, about all they need to know about, you know, pregnancy, childbirth, and even the motherhood period. And that went on well. And it's still going on well, but just that recently I decided to switch the model a little bit more to advocate more for midwives so that our profession is going to be more heard. And then after 2 years of running the blog, I was like, there's still something we could do. Okay, so the blog is like the talk part of the work, and then we are going to introduce an organization which is going to be the action phase of the talk we are doing. And that is how For Mom and Baby Foundation was birthed in 2021, April of 2021 to be precise. And so far it's been really good. We've engaged with so many women. This foundation has spoken the mind of so many midwives who feel stuck, and so many women who feel depressed or unheard about health profession, towards the health profession, and we have been able to bridge the gap between access to maternal and child health care. So thank you very much.
Thank you. Maïa. It's a moment.
Well, at Live, we started from the basis because we were patients for some of us, and we started thinking, okay, what can we do to improve the care of women that have been diagnosed after 7 to 10 years between their first symptoms and their diagnosis. So they have already waited 10 years in France to get a name. Okay, it's endometriosis. And then what's next? Well, if they live in Paris or in big cities, they can have access to expert center where they can receive multidisciplinary care. But in some areas in France, there are no gynecologists. There are no healthcare professionals trained about endometriosis. So they can access to they can have access to the hormonal pill, they can have access sometimes to surgery, but mainly they have to find solutions by themselves. So they go on social media and they can access to information that are sometimes relevant, sometimes not. So that's why we created this digital therapy. I mean, it's programs where they can follow, and it's based on integrative medicine. And after 3 months, they become actress of their disease. And after 3 months, we have studies that have shown that they have reduced symptoms, and they are 3 times more likely to have a better quality of life, despite still having the disease, because I'm saying it again, there is no cure. So we have to learn how to live with the disease. So we have this program, but then we thought, okay, how can we get access, give access to this program to a lot more women? Well, we are working with private insurance that are providing access to their injuries, and we are also working with company, because employers, and that is really a matter of hope, they want to handle this problem as well. They are saying, okay, I know that 10% of my employees, I mean, the women part, might suffer from endometriosis. And this has an impact on their work. I mean, it's 11 hours per week of loss of productivity. 11 hours. So employers are taking the problem into their own hands, and they're contacting us. And we are working with several great companies that are offering an access to the digital program for their employees. So that's one part of massifying our impact. And another part is that we are doing more and more scientific studies to prove that this is helpful for women in terms of quality of life, in terms of symptom reduction. And with these studies, we are going to apply to get public health coverage so that all the women in France can have access to the program for free.
Thank you. So I find it fascinating that all these 3 individuals are doing, there's a common thread here. The common thread is there's a curious lack of education. I don't know how many of you knew some of these amazing horrific stats. 7 to 10 years, surgeries when there is no surgical solution, access, lack of knowledge. And it sounds to me that you are both anecdotally as well as scientifically trying to spotlight these issues, right? So what would give you the next level of support? What would dream capital look like? What would that world look like where there would be, what's the next mountain that dream capital could solve for you? Okay, I see a lot of smiles. All right, Isa, go.
I guess there are 2 parts. Education, both for women and for practitioners. And I think we can come back on that because we have lots of things to say on this.
We can come back, absolutely.
And there is this R&D issue. And I think that we can do the most as we can on the patient part, on the practitioner part, but I think we do need support from the pharmaceutical and R&D world. I was talking to a pharmaceutical company a few weeks ago. It was telling me how Jeen is amazing, what you're doing, blah, blah, blah. And I said, okay, what do you do right now on women's health? What are your big projects? And he looked at me and he said, we're not an NGO, so we're not really working on this. I was like, okay, there are quite a lot of work to be done. But so that's this part. And I think on the other side, on the practitioners and women part, I think for the practitioners, I think first is integrating these women specificities, of course, in the studies. And I think it was so true when you talked about the art of listening, which is a huge part of medicine. Now we train our doctors to be super effective on the anatomy part, like the gynecologists, they're the best. But not one time in the 10, 12 years of studies, we will train them on how to talk to the patient, on how to listen to the patient. I think this is 50% of the job, I think.
Radical listening. Yeah. Radical listening. Sounds like everybody here is talking about that. Whether it's climate crisis or health crisis, we need to listen. Please.
All right. So for me, my dream capital will be a beautiful blend of resources stemming from economic, social and political. On the economic aspect, we have the financial, the financial zone, the big financial zone, which of course we are not for profit. We run on funds, and sponsorings and all that put together, because we have a lot of work that we have to do with respect to menstrual hygiene, with respect to pregnancy, with respect to preconception, delivery. All those things need money to keep them running. And sometimes it gets really frustrating because the women get to us and they're like, we need more of these things, we need more of these products, but we are limited because we find ourselves in the low and middle income country with little or no access to all this huge funding. But we are very hopeful that we'll be able to help majority of these women. And then there is a social aspect where we are hoping to have so many more people join us, not just in Cameroon. It shouldn't just be a movement in Cameroon. It should be a worldwide movement, because 95% of maternal mortality rate is caused by things that could be wholly prevented. 95% of the women who die, there are things that could be really prevented if only the women had the right access, speak to the right health professionals and, meet the right hospitals. And finally, the political aspect, we need all the networks we can get in order to loud the voices of these women, loud the voices of midwives, and loud the voices of, everything that has to do with women's health. Thank you.
Thank you. Very well said.
Well, in terms of dream capital, well, I think R&D should be funded. That's what I said. I mean, for endometriosis, research is 15 times less funded than for other diseases with equal prevalence. I mean, it's like the prevalence of endometriosis is equivalent to diabetes for women. And it's 15 times less funded. So we need investments to do research. And at our level at LIVE, we are contributing to research on our program, but also on we have other research programs with institutions and public researchers. So we are raising funds, and we are raising funds to run studies and for our trajectory towards reimbursement. So we are currently discussing with VCs that also want to help us revolutionize healthcare in endometriosis.
Fantastic. So it sounds like we need to identify, which they have identified a problem. We need to plan. We need to invest. We need the data to tell the story, and you're already telling the story. So it's all together. So what in this gives you hope? What gives you hope? You can go in whichever order you want. Go, Isa.
What gives me hope is that there is this huge trend that we see, and we're together on stage, and there were no stage on women's health last year, so we start talking about it. And specifically at Jeen, my hope is that we really identify great practitioners who want to work differently. I mean, they're the DNA of medicine today, and at Jeen we see that they want to work differently. We just need to give them the tools. And we have succeeded in doing that in the first health centers, Jeen. So we'll keep doing that, and we see the impact of women. We have 20,000 women who came at Jeen since the opening, and the feedbacks are amazing. And there is this energy that goes through the woman who comes into the center, and I think that by dividing these kind of projects, our projects will empower all the women, and I do think that we're in the right growth, the right path.
So what gives me hope is the resilience of the human spirit, particularly for mothers, because they'll go above and beyond to ensure their babies are fine, and regardless of even how they feel, they'll always put up a strong face to, make sure the family is up and running. And that's why we won't relent our efforts to make sure that they are fine. And, health-wise, women's health is prioritized and, made top priority in every profession. Thank you.
Well, as for me, what is giving me hope is that there is an incredible impulse at the moment on the endometriosis field. I mean, we are finally talking about it. I mean, we are talking about menstruations, blood, digestive symptoms. Sorry about that, but that's the reality, and we are finally talking about it. So it's incredible. Patients are started to be heard when they talk about symptoms and pain. Physicians are starting to be trained about endometriosis. And there are several national plans that have been launched worldwide, and this will bring funds to research as well. So I think there is an incredible impulse on women's health, on endometriosis. So there is a lot of hope.
Thank you. So what is interesting to me in this whole session here is ChangeNOW's foresight to bring health into a climate space. And this is a room full of change makers, so you may not think anything odd and awkward about this, but up till 2 years back, health people went to their health conferences and climate people went to climate conferences, and we didn't think that healthy people and healthy planet has any correlation. Having this panel and having ChangeNOW organize this and recognizing that unless we center health and we center women's health and we mainstream women's health, we will never achieve the planet we want to achieve. So I think that is what gives me hope. But that is also what brings me to my final question of these panelists, and any of you can offer, is what is the impact of climate on women's health? Studies show us it is disproportionate. What, Maïa, would you like to share?
Yeah, happy to share about that. It's mainly about an ecosystem point of view. And we talk about exposomes in research. There is actually one research unit in Paris that is incredible and doing incredible work on the subject. I mean, what are women exposed to from prenatal up to their death? And they're exposed to pollutants, they're exposed to endocrine disruptors, and for endometriosis, there are studies that are linking endocrine disruptors, pesticides, to risk of endometriosis. Some food categories as well, for example, red meats. Red meat consumption is linked with endometriosis risk. And patients, they are advised to eat more organic food, less ultra-processed food, to diminish their exposure to pesticides and endocrine disruptors, because endometriosis is impacted by steroid hormones. So there is a direct impact. There is the part of the hereditary part, I mean, what our genes, and there is some part played by the genes in the endometriosis, but there is also the part played by the environment.
Fantastic, thank you.
Thank you. So I met this soon-to-be friend of mine, because today is actually the first day I met her face-to-face, Charlotte. And she is the founder of Mukuru Clean Stoves. And I was just telling her, this innovation needs to come to Cameroon. Why? Because so many women in the area where I come from work with firewood, you know, they get the smoke all in their lungs, even when they are pregnant. And, you know, pregnant women have it really difficult breathing, because everything they do, they are breathing for two, eating for two and everything. So when they have this smoke in their system, it makes it difficult for them to breathe, and they start experiencing respiratory distress. So it's very important that so many things, and this is just a typical example of how climate change or, you know, issues like this affect women's health. Another aspect, which is really, really something I recently got to discover, is that breastfeeding is actually something that you know, pushes the agenda of climate change positively. And I'm going to explain. So did you know that formula feeding, you know, and the cans and all those things, after using the formula, you have to dispose of the can. Do you ever think of how that can is disposed? Do you ever think of what goes on? But then there is breast milk in the breast, readily available. The baby can just suck and it's filled. You don't have to throw away anything. And, you know, it makes life really easy. So I really think that women's health has a lot to do with climate change. Thank you.
Wonderful. Thank you. We do have room to take audience Q&A, because this is the cool stage, right? We are in the cool collective stage. It's called collective for a reason. So if any of you would like to ask any burning questions while we have these very smart change makers here, by all means raise your hands. And absolutely. Let me bring a mic over.
Thank you, first of all. For
Would you introduce yourself too?
My name is Marie Kavanilla. I am from Austria. I'm a student currently here at ESCP studying sustainability management, but hoping to one day be as successful as one of you. I'm hoping to get into the field of femtech myself and focusing on menstruation and using the female cycle to your advantage. But something that I've come across just in my own personal tiny little history so far is how do you manage to stay optimistic and positive with all this also rage against the system and the frustration of what's going on and how little support there is? How do you manage to every day say, okay, this is worth fighting for, I'm going to continue, this is necessary, because it absolutely is, but we're not always given the support that we should be.
Brilliant question, thank you. Absolutely, let's kick it off here and then...
I'm going to respond to that. So my secret is that I run with a vision. The moment I think it, I do it. I don't give people the room to discourage me. You know, like the instance I told you guys about my siblings, that particular instance, I found a way to encourage them to support me in what I'm doing. And it wasn't quite easy, but remember I told you, I just kept running with the vision. I wasn't disobeying them, but I was just being wise and smart with the way I presented my case to them. So just run with the vision, because the moment you want to pause to say, no, I'll think about it, maybe it isn't going to work out, at that point, you already cool the vision. You already kill it instantly. So once you think it, do it and run with the vision.
Absolutely. And we are collective people. Look at this room, look around you. You're all change makers. When we come together, we create magic. And that's what we have to remember and remind ourselves. So we're going to continue this panel. I'm going to request these amazing panelists to please take a seat here, and I'm going to invite the next part of the session. So please give them a rousing hand. Find them. You have seen them. You know their names. Reach out and keep asking them questions. Thank you, thank you, thank you. So I am now going to invite Thorsten Kiefer, who is a man with a beard. Thorsten was going to join me on the stage in a minute and talk about menstrual health. Yes, isn't that a topic I think a lot of us should be aware of? We know about it, we've read about it, we experience it. Here's a cool fact. Every month, 500 million women, that's a pretty big number, and girls around the globe, they do not have the resources to deal with menstrual health, something which happens to their body every month. Did you know that 23 million girls, according to UNESCO, drop out of school because they don't understand menstrual health? And therein lies our problem. And therein lies the whole equity justice issue, which disbalances a lot of what we are trying to achieve in the world. And so without further ado, Thorsten Kiefer, will you join us on stage, please? The man with the beard. He's going to boldly talk to us about
Great to be here.
Right. It's fascinating to sit with a man with a beard and talk about menstrual health. I hope you find it as weird as I'm finding this, right? So tell us, how is a man with a beard talking about menstrual health? Share that fascinating story.
The longer story, right?
I think we have time. Shall we? Shall we let him give us the long story, or shall we ask him for an abbreviation? I think you should give us the long story, the real story.
So in my old life, I used to be a human rights lawyer.
I love it. Old life. All right.
Working on the human rights to water and sanitation. And when we started with Water United back in 2010, we ran a big campaign around the 2010 World Cup in Sub-Saharan Africa that used football stars as role models to challenge the taboos and stigma surrounding toilets, right? Toilets, because everybody always loved to talk about water, the blue gold, and nobody wanted to talk about sanitation, and the issue kept being neglected, and that was something that really pissed me off, because data was coming out showing us that diarrhea caused by poor toilets was killing more children than malaria, measles, and HIV/AIDS combined. So around the 2010 World Cup, I used to be a huge football fan. I still am a big football fan, but not as you. So I wondered, like the football, first World Cup in South Africa, in Africa, how can we use that to drive social change? And I was asking organizations, can we do something about sanitation? Can we start conversations about the issue so that gets more attention? And everybody was like, no, like that's a difficult issue. Let's not get David Beckham involved in that or this. We keep on working on the softer issues. So I approached a friend of mine who back then was the head of legal at Bayern Munich and asked him if he would help me get some of those stars involved as toilet champions for Africa. And he said, let me give it a try. And first, Bastian Schweinsteiger, who was back then the up-and-coming star in the German national team, said, I want to be a champion for toilets in Africa. And once he came on board, DJ Drogba said he's going to be one too. And he back then was the biggest role model for kids and young men in Africa. And him talking about toilets changed how people would think about it, because if the coolest guy on the continent can do it, I can do it too. And so we did a campaign in 8 countries around the 2010 World Cup and thought, like maybe that's it a little bit, that was great. But then people from India came towards us and said, hey, we have another sport here called cricket. And I was like, cricket, croquet, like, okay, they explained to me. And
you get very excited about it.
Yeah, and make this is very, very big, and can we use cricket to tackle an even bigger challenge in India? Because like in India, back then, 2012, 50% of the population was still openly defecating. And we went there and developed a campaign together with the Indian government. Back then, it was a Congress government. And there was a super senior minister called Jairam Ramesh. And he had decided he wanted to break the taboo around toilets in India, which, as you know, like in toilets in India, it's an issue for Dalits, for untouchables. Nobody can talk about it. So he was going to be a champion for a toilet campaign. And he would say things in national television, toilets are more important than temples. We need to build toilets, not temples. And had Hindu mobs, like BJP mobs in the streets, shouting. And we started planning this campaign, and we agreed that there would be a component, a menstrual hygiene lab, as kind of like a way to put a toe into the water to see how important that issue would be. And we agreed on that, and the day before the launch, his office told us, we know that he's a daredevil, he dares to talk about toilets, but this menstrual hygiene thing, that was too dirty. He wouldn't talk about it, and neither would we.
Felt too taboo, felt too uncomfortable.
Yeah, and we were like, what? That issue is even worse than toilets? And we had a big standoff with him, and at the end of the day, he said, okay, I'm not going to talk about it. You can. If it flies in my face, you're fucked. You don't have my support anymore. And okay, one of our colleagues from partner organization talked about the issue, nothing happened. Then he traveled with us on this campaign. On the first stop, he saw how the queues of women and girls trying to get into this menstrual hygiene lab to learn about periods, to learn about products was so big that we regularly had to shut it down because we just couldn't manage the masses. And I was standing next to him when he told his assistant, both male, of course, maybe we need to reconsider and maybe we need to think about how that can be part of our sanitation policy. Half a year later, it was in there. But for me, that was like a wake-up moment. There's an issue that is even more taboo than toilets in India. And us men, we're a key part of the problem.
So this is very fascinating. And I'm sure a lot of you have faced this because irrespective of the topic we are working in, we're all dealing with topics which are taboo. Half the world doesn't think there's a climate change problem, right? I mean, let's not go there. Half the world doesn't believe there's a gender problem. Half the world doesn't want to acknowledge women's health issues, even though we are 51% of the population. And then we dive into topics which have been seen as taboos, uncomfortable. We don't talk about menstruation. We don't talk about sanitation. They're supposed to be a private business. So entering into this head first with a marketing lens, it's a double-edged sword. How did you've shared with us how you approached it. How was your journey to getting people to buy into it, to finance a solution like that? Because that's a common challenge we all face here. Whether you're a non-profit, whether you're a for-profit, and you have an amazing idea, you recognize the problem, you create the project. What were some of those challenges you faced trying to finance a taboo topic?
So once we came back from this campaign in 2012, we thought about what is the solution to that, right?
Right.
And back then we looked at like the global landscape, what was happening, and there was a bunch of voices here and a bunch of voices there, but nothing coordinated, nothing powerful enough to break through this taboo. And I always imagine it. Did you ever watch that James Bond movie Goldfinger?
Of course.
Yeah, you know, remember that scene where it's the big slab of gold and
Yes.
James Bond is tied, and then the laser comes and cuts through the gold and tries to cut him in half. And I've always thought about the taboo like this big slab of gold. And what do you need then to cut through this big slab of gold? Like, you need a laser, you need to bundle voices. It can't be just one person talking here and one person there, but we need something that is very concentrated and focused. So we thought about what if many of the voices working on menstrual health and hygiene would speak on the same day, would bundle their voices, so that we create kind of like a laser beam that can make a dent into taboos and stigma. Okay, interesting idea. So what if there was a day dedicated to menstruation, like a menstrual hygiene day, like there's World AIDS Day? Okay, when could that day be? 28 days of the cycle, 5 days of bleeding, 28 May menstrual hygiene day. And so we thought, okay, do we now need to ask Ban Ki-moon for permission? Or we just say it exists and see like how many people agree with us, and then what happens. And that basically was our first kind of like big project then. We started that in 2013, the idea, 2013, the first menstrual hygiene day. And this has developed over the years into the biggest global campaign on menstruation. Just to give you, doesn't work?
Oh, it does. Oh, I'm seeing it there.
Oh, okay, then we go back. So it has grown really from a wild idea to a global campaign with more than 1,000 partner organizations around the world who use content we create, hashtags we create, narratives we create, contextualize them to their own stories, be it in Bangladesh, be it in India, be it in Latin America or the Caribbean or Australia or anywhere in the global north. Partners all around the world participate, contextualizing these stories and joining a global campaign that then happens around Menstrual Hygiene Day. And this enabled us, this collective, we're in a collective stage, this collective impact model enabled us to drive the conversation from, we see here in the first year we had 89 pieces of media coverage, and we celebrated back then. Last year it was almost 18,000. So the growth is enormous. And yeah.
Therein lies a brilliantly executed marketing campaign, right? This is a dream.
Yeah.
Share with us a little more, if you will, because you did something which all of us talk about in a theory book, right? We talk about bringing both men and women, because of course there's no solution which is ever going to solve by one or the other. You also have used a master stroke of taking a popular sport-like thing and linking it to draw awareness and to creating the day. So how did that work in our favor? Do you want to tell us a little more about how you brought these elements? And did this successfully drive the financing? Like, what was that breakthrough moment for you?
I think the breakthrough moment was to really think that is a collective impact model, where it wouldn't be Wash United that runs a campaign, but where we would be almost like a service provider in the background that creates the framework, you know, like the creative framework and the content, because there are so many organizations around the world that are brilliant in doing the work on the ground, but they don't have the capital and the resources to develop kick-ass campaign strategies and content. So for us to say, okay, we do that, we create kind of like the framework and we make it contextualizable for everyone. We don't put our logo on it, but we give space for everybody else to put their own logos on it. We don't put our story in it, but we create a model where everybody can tell their own story on the ground. We just do that all around the same day, and we use some common things like a logo, like hashtags, like some visual elements that binds it all together. And that, in the end, was what created ownership of partners. And that means that partners are participating, that they're investing their own resources in organizing their own events, in organizing their own campaigns. And that makes it really like a movement where we are the first domino stone that starts, but there is so many else that make it big. And in terms of finances, I think that is also a big part of what enabled us and enables our partners to raise money, because one of our big story to our funders, to our foundation funders, to our government funders is that the money that they invest in us in developing the content is not just going to be used by us, but by hundreds, now more than 1,000 partner organizations who will benefit from that. And from our partners' perspective, their story is, listen, we don't need to have the upfront cost in creative content development. We do the execution because somebody else, these guys from Germany, they deliver all that, and that it really creates a synergy that enables us to leverage resources and create impact at scale. And I think another point from our own perspective, what enabled our funding, our fundraising, was, I mean, like we're working in really difficult times right now. There's a pushback against gender equality. There's a move to the right all across Europe. Countries like Sweden, like the Netherlands, who used to be steadfast funders of gender equality, are now dominated by right-wing parties. And that means defunding gender equality work. In Germany, our government is now shit scared of the upcoming European elections, like state-level elections. So everything that can be considered too woke, potentially, is not being touched anymore. But what has helped us is really develop MHD and grow is our corporate partnerships. Because what we have learned early on, and we've been working with Procter & Gamble for 7 years now, Kimberly-Clark entering into the 5th year. What we started to learn is that the work that we do in pushing back taboos and stigma leads to more demand for menstrual products. Because the more open the conversation is, the more dads, the more parents, the more husbands are willing to dedicate household income to women's menstrual health and hygiene, the more women and girls know about the need to use proper products, the more demand there is for products. So basically for the whole femcare industry, for the period product industry, we're something like a gigantic market development initiative. And when we talk with our corporate partners, that is part of like what we tell them. Listen, we don't directly sell you products, but we are making the cake, the pie bigger. And if you have 20% market share globally, your 20% pie is going to become a lot bigger if you let us do what we do. And for that, we need the resources to make it happen.
That is fascinating. So I heard a few things in there, and I'm dying to ask you more. You talked about, one of the challenges we face is a language barrier into collective action. Mm-hmm. The other challenge is always translating it into the local context.
Yes.
Share with us how you overcame some of these things. Was it technology? Was it people? Was it everything?
I think technology really is a big part of it. And I think what I just said about like ownership, and I think it has been part also like of my personal journey. I mean, I've been an Ashoka Fellow for more than 12 years. And I think one of the things that is really in the DNA of Ashoka is like indirect impact. Not growing your organization to do more and more, but enabling others to create indirect impact. And I think like that thinking has gone very seriously at Wash United about 7-8 years ago, when we really thought about what can we do to really make sure that we step back and others step forward and use their own resources to work together with us to create collective impact. And at some point you get to things like, okay, like you're creating cool stuff, your normal reaction is putting your logo on it. If you put your logo on it, you disincentivize others investing their own money to implement it. But if you don't put your logo on it and you tell others you can put yours, then suddenly it becomes their product. And they're implementing it, and you don't have to pay for implementation because for them it feels like their own. And things like that, really overcoming ego, taking a step back, doing things that are counterintuitive, not putting your brand on it, but telling people you can put yours. Now, for instance, this year, for MHD, it's the 10th anniversary, and we want people to contextualize the hell out of this MHD. And so basically, this year, we're starting to put all the creative content on Canva. So basically, everybody can, cook up their own stuff and really be creative and play around with it. And a lot of these things take courage, and they require one to move away from like an incentive or a tendency to try to control partners to really let go. I mean, like the same thing, we also do a lot of work on menstruation education, where we have developed a curriculum that, in my opinion, is the best and easiest to scale and low cost there is available. It's now available in 28 language version. My colleague Lena is sitting there. She will wave No, she's gone now. She's there. So if you want to learn more about our MHH education work and the free products you can access there, speak to Lena, please. But there again, we put so much knowledge and heart into creating these products. So at the end, they were ready, and we decided as a team, after long discussions, we're not going to put our logo on them. We're just going to give them to partners. And then, of course, you have some partners will take advantage of it, maybe even sell it, maybe use it commercially. But at some point, we decided that there's always going to be 20% of people who won't play fair, but 80% will probably play fair. And the relationship you have with these 80% will determine your success. And I'd rather trust 100% and be screwed by 20% and have a great relationship with 80% than make it difficult for everyone to work with us. And things like these have been absolutely transformative in how we work with partners, what our attitude to partnership is, and how partners also work with us.
It's fascinating. Thank you. How do you manage the quality control of the product, or not?
We do. I mean, we have regular reporting with partners. So every once in a year, they get back to us. They tell us how the implementation goes, what they learn, and what they think should be improved. But for much, we trust them because there are organizations, they have a very strong incentive to use their own resources for the best benefit. And the moment you stop paying people to do something for you, why should they do it bad, right? They send people to work to do it, and maybe they will do it a little bit different than we think it should be done perfectly. But hey, it's their project. They want to create change at a local level. At some point, we decided that we want to let go, and we want to have trust-based partnerships. And sometimes, of course, things will go wrong, but they will also, if you control.
That's fascinating. Trust-based partnerships and trust-based is a movement in philanthropy as well, as I'm sure you know.
Yeah.
So with that comes the question of then how do you manage data collection? And how is that, because that's the bear we all face, is how do we show the value of our impact? And a lot of it is rooted in data. And so how do you do it for yourself, and how do you do it for the partners, if you will, for them to be able to showcase impact?
I mean, a big part of that is technology. And for instance, for the global MHD campaign, there is absolutely no way we would be able to do that without huge investments in technology. And we're happy to have a low bono partnership with Meltwater, who is one of the premium companies when it comes to media monitoring and social media monitoring. And they help us a lot. So we have a Meltwater solution that we could normally never, ever afford. That goes in six-figure sums if you paid it at market price. That helps us to really track media coverage, to really track social media. They help us build formulas to calculate cross-reach into net reach. They really put their heads together with our creative directors, our creative team, to really calculate then reach and show how the work that we do, especially around Menstrual Hygiene Day, changes conversations around the world and pushes back taboos and stigma.
Fascinating. So you're a success story. Tell us what's next. What's the next new thing we should expect coming out from you? And which could be the next challenge and what, or the next innovation?
So one really big challenge is getting funding for the topic. And I'm not saying so much for us, but I mean the issue as
yes,
such.
It's a taboo topic, right?
We're talking about an issue that affects half of humanity. And there's not a single major government funder, not a single major philanthropist, not a single major global foundation that has menstrual health and hygiene as a priority issue. I'm repeating, not one. Not one. And we're pushing very, very hard to change that. So we've been working with the French government, Agence Française de Développement, who is now about to launch a $10 million fund to support feminist NGOs in the Global South working on menstrual health and hygiene. That's the absolute first. That's the biggest commitment to NGOs that has ever been made on this issue. We're working with the World Bank, pushing them. We're working with the German government and have managed to get them to now include menstrual health and hygiene into their gender action plan. We're pushing really, really hard to get more funding. But one of the challenges is menstrual health and hygiene is not part of the SDGs. There is no OECD DAC code. So really people don't track, which is why we have now launched a new advocacy tool that we call the Menstrual Health and Hygiene, short MHH funding tracker, where we look at who funds it, and where we put it on a certain, a single searchable database where everybody can find information. So we're providing advocates with the ammunition to hold funders' feet to the fire, and we're providing advocates also with the ammunition to go and say, hey, listen, German government, here, the French government is funding, here's the data, what about you? Tanzanian government, look at what Kenya is doing. It's possible, right? So what about you? So to create this peer pressure between in regions, but also between categories of funders. Because, for instance, now the Gates Foundation has shared their data with us. If I can go to a foundation and tell them, listen, guys, the Gates Foundation is starting to fund this issue, here's their data, that makes it more relevant, and that reduces the risk for them of getting into the issue. Because you need these big flagships that kind of like are inspiration, that serve as examples for the smaller funders. So that's one of the big challenges ahead, mobilizing more funding for the issue, for small NGOs, but also for the UNICEFs and USFPAs of this world, who all lack the resources they need. And then the next big thing that is coming up is this year is the 10th anniversary of Menstrual Hygiene Day. So it's, and we're super excited, and we're seeing so many new partners coming on board and so many new organizations wanting to join. And so the big challenge really continues to be like breaking the taboos and stigma and starting a conversation. And we're here and Change Now. So I would call on every single one of you, help change this now. And it's very easy. You can do something that is very, very simple. The thing that you see here on the slide, that is what we call the menstruation bracelet. And when we, exactly, Martha is showing hers, when we started to have conversations about the issue with decision makers, especially men again, what we always noted is like it was very hard to break the ice in the beginning. So we thought about how have other issues done that? And we thought about a symbol. So we created a symbol, 28 beads, 5 of which are red. It's round, it's a cycle, so it's a symbol for menstruation. And we've been pushing that as a symbol for people to wear, because if you wear that on your wrist, you're showing that periods are nothing to hide. You're wearing it where you normally wear your jewelry. And by doing that, you are making a statement and you are helping to start conversation and break the taboos and stigma. And the bracelet I'm wearing and Devika is wearing is a very special one. We sourced that through a social enterprise in India. It's handmade clasp beads, every single one handmade and hand-painted. And my colleagues here,
we can invite them all back on stage.
Lena and Sophia, again, shake, please wave. They have about 100 of them with them. And 100 first people that come here and give a pinky promise that you're going to wear it for the next 2 days, that you're going to talk about it to a couple of people, and that you're going to post a picture on Menstrual Hygiene Day, you're going to get one for free. So that is what all of you can do.
You can see he's a consummate marketer.
And how all of you can become part of the solution.
I love that. I love that closing. We are all part of the solution. So, Thorsten, thank you so much. Is there any other parting words of wisdom you'd like to share with us?
Well, I thank you so much for having me here and really daring to talk periods with a man on stage. And maybe let me add that. I mean, like, that's also like how I see my role a little bit, because there is a bunch of guys in the room, and I also want to encourage them, to become agents of change, because ending period poverty and stigma is not a women's issue. Us men have weaponized menstruation over history. We've written the religious books, the Bible, the Talmud, the Quran, where the taboos and stigma around menstruation were first kind of like solidified. We are in a position that we have to help change that. So I'm really calling to all the guys in the rooms, I want to see you come to my colleagues, get your menstruation bracelet and wear it, because it's something we have a duty to be part of the solution here.
I agree. I think instead of calling it a man-woman issue, I think it's better to think of it as it's a half of humanity.
Yeah, it's a human issue.
It is our future. And with that, I'm going to invite our panelists back on stage for a last collective call and for an opportunity for all of us to see how we need to bring science, industry, marketing, and everything to any solution that you are all bringing and you are working on. They're all interconnected. We lead our lives in an interconnected way. We need to listen, we need to ideate, and we need to find a collective solution. We need to do the 1-2 principle. I am because we are. So with that, let's all show our bracelets and say that, yes, let's find solutions which work for 50% of humanity. Yes? So thank you. Thank you so much for being with us. Please find all these amazing change makers. Give them a hand. They're courageous. They formed companies. They formed research. You know, and what is fascinating is that north to south, we have people from every part of the developed world. And what is fascinating and horrifying and hopeful is that we are all facing the same challenge. So it doesn't matter whether you live in France or Germany or Cameroon or India. We are not talking about mainstreaming women's health. Until we do that, there will be no solution for the climate or for the planet. So without further ado, we close this panel. Thank you so much for joining us. Find these people, get your bracelets, and get your solutions.
Thank you.
Thank you.
Thank you, Devika.
Thank you.
Wonderful.
Was